So it's 1 o'clock. I think I'll get us started today. So this is Ed Crowe. Thanks for coming on. Happy Thursday, everybody. I think I've been told it's nice out. I haven't checked it out yet, but I've been told it is. So we're going to go through a webinar today. We're going to do a lot bigger topic than I usually do. I usually try to be a little more narrow, probably not narrow enough with the topics, because the idea is to try to keep these things around 15 minutes. I'm going to try to keep this one fairly short. It is a lot of information, so I'm going to take a different approach with this today. I'm going to go through it, but all the areas where you could drill down and get really specific, and there's a bunch of them in here. At the end, I have a slide that's going to point out a bunch of webinars I've already done that are specific on those topics. So kind of idea is to go through this in general, talk about what you would need to do, the best way to be set up and go about things. But then when it comes to areas you're really specific, I'm going to point out on the last slide all the webinars on our YouTube channel that we have that will drill down on those topics. So yes, that sounds incredibly boring, but if you want to really get so you know these areas, that's what I recommend, or you can do online research or however you want to go about it. So a couple things before we get started. I always say this, but here we go again. If you have questions, send them into the question section. You can send them in right during the webinar. I will answer them at the end. So as they come up, as we're going through, feel free to ask, and then when I get done, I'll answer. And we do record these. So we record all our webinars. We put them on our YouTube channel. You can see there, youtube.com/@Crowe Medicare. And we also send a copy of the email out to people that register for our webinar. So if you registered for it today, even for future reference, if you don't come on, you'll still, if you registered but didn't attend, you'll still get it emailed. But I definitely would recommend going on the YouTube channel, because again, I'm going to reference a lot of webinars today that we've done in the past that get specific on a lot of these topics. Okay. If there's no questions, I think I will get started and go from there. So our agenda, again, big agenda, a lot of topics. So we're going to be fairly high level on these. So we're going to talk about everything to know for Medicare sales. It isn't everything. It's kind of a lie, and I don't try not to lie much, or we'll call it, salesiness, but it's a lot of it. Information to obtain that you want to obtain from prospects. For newer people, I get that question a lot. What systems to use? So I'll give you a general idea what you need for systems. Medicare A and B enrollment rules, how to determine the right product, build a cross-sell opportunity, going to be really important as time goes on. You can make extra money and help the client out as well. Talk about enrollment rules. That's probably a big one, even for existing agents, is just always I try to reiterate enrollment rules and talk about election periods and stuff, because we get a lot of questions on those. Ways to enroll people, which for those who have been doing this, you'll kind of know those. Tracking, follow-up, and referrals. And again, there's the YouTube channel, and I will answer questions at the end. So let's hit our slides. Okay, we're going to talk about pre-appointment and scope of appointment. Still get a lot of scope questions, even from experienced people who have been selling. So can never talk enough scope. You really want to make a party exciting, you start talking about scope of appointments and the rules for them. What you should try to do with an appointment, whether it's in person or on the phone, either way, is you should try to get basic info from them ahead of time. It's best if you can at least get their medications, their doctors, and their location, so that way you can load that into Connector or Sunfire. And I emphasize Connector or Sunfire because that is superior to using Medicare.gov. On Medicare.gov, you can't enroll the people through there. And the other thing is you need a username and password. It's not efficient to use it. And we still have a ton of agents that use Medicare.gov as their main source to quote things, versus Connector and Sunfire, you can save all their info. So you can save all those things so you don't have to re-enter it again next year. So if you're not using Connector and Sunfire, I strongly recommend you do so. Not for me, but for you. It's just way more efficient that way. Anyway, load their information in there ahead of time. You should also get the scope ahead of time if you can. Remember, you've got the 48-hour scope rule. The carriers have not started to crack down on that yet. They are really still very focused on recordings and getting the scope in general, but I'm sure they'll get to it. But you need a scope 48 hours ahead of the signature date, except for the 3 exceptions, and that would be a walk-in appointment that waives the 48-hour requirement, an inbound call. So if the call's coming inbound to you, you can get a same-time scope. And if you're in the last 4 days of an enrollment period, All three of those things will waive the need for a 48-hour scope. Otherwise, you need it 48 hours ahead of time. It needs to be dated 48 hours ahead of time. So not doing scopes, like I said, the carriers aren't cracking down on the 48 hours as much yet, but not doing them will get you in trouble. We have had people who have had carriers inquire about cases and they haven't had a scope, and there's been trouble when that happens. So if your appointment is not face-to-face, also remember, and I just tossed this in, you got to record. I just want to bring that up because we're getting a lot of people, not a lot, but we've had a fair amount. When people have gotten in trouble, it is for either not doing a scope, but probably more commonly for not doing the recording. So if you're not face-to-face, you got to record, and that will get you in trouble for not doing it. It really will. And I've had a couple people that are facing probably being terminated for cause for not doing recordings on a lot of phone enrollments. So do them. You can get this scope by text or voice through Connector or Sunfire. And that is the best way. If you need it 48 hours, because it's not one of those 3 waivers, get it by text or voice scope through Connector or Sunfire. Again, if you have questions, just ask as we go along. Okay, so what information do you want? And you know, this seems so simple, but I got to tell you, we get a lot of cases where the information wasn't obtained and the agent is trying to write the case and they don't have the basics. So that's when mistakes happen, sometimes big ones. So really important to get the information from people, to ask them the questions, and also to document it. So you obviously want their date of birth. And even myself, I a couple times have talked to people, haven't asked them for their haven't asked them for their age, just asked them for their date of birth, and I haven't thought about it. And they've turned out to be a supplement client. And then lo and behold, later on, I don't even think about it, that person is on Medicare, but they're not 65 yet. Maybe they're 63 or 64. And that makes an ass out of me because I maybe quoted a Plan N, and you can't give Plan N to somebody under the age of 65. So just really important to know their date of birth, know their age. I always say, what's your age too, because I'm bad at math. So you want that information, or if they're 65 plus, you want their address, their resident address. Make sure, just once in a blue moon, you can say to somebody, what's your address? And they'll give you, maybe they got 2 houses, and they'll give you the address for the state that's their non-resident state. So just make sure it's their resident address. Make sure they have Medicare A and B. If they don't have it, when are they going to get it? Really important. And again, I get questions. Sometimes I'll talk to agents and say, well, what do they have now? And I'll get, well, I don't know. Is their current coverage? Even if they're turning 65, you got to know what they have. It gives you a much better idea of what they'll probably be more likely to want to enroll in. They're in a group health plan with a deductible, and Advantage is probably going to be an easy transition for them. Maybe they're in a plan that is a supplement of some type, or maybe not a supplement, but a plan that's like an indemnity based and just has tremendous benefits. Or if they're over 65, same thing. Find out what they have now. It's important. Get the details there. If they're turning 65, and are they through a spouse or employer? If that's the case, if they're getting coverage through their spouse or employer, how many employees are at that company? And you're asking that because you're checking to see if that's a company of less than 20 employees, which is important to know. And then because for that reason, you want to try to find out if they have a valid waiver for Part B. Maybe they get coverage to their spouse, they're turning 65, but the spouse is 61 and is going to continue working. And maybe they don't have to go on Medicare at all. I mean, that's not good for us, but you still got to give them accurate information. So maybe if they meet the 3 criteria to waive Part B, and again, that's a webinar. I did a webinar on the 3 criteria because you need to know that. That's important to know. So get an idea what their current coverage is like. Medical conditions, I know, listen, Medicare says you can't ask medical information. You have to have a general idea. To do your job well, you have to have a general idea, and you'd want to know, okay, what kind of treatment are you getting, or how often are you going to the doctor, the hospital? You really need to know that because that'll play in later on too. Is this an Advantage or a supplement person? List of medications, obviously. Get the meds, get the doctors, get the pharmacy, and document it if you can. The reason I say to document it is what you don't want is down the road a complaint to come in and the person to say, Paul didn't check all my drugs and one of my drugs isn't covered. Well, come to find out, they didn't give Paul the name of that drug. They forgot. So if you can document, have them email you the list of doctors, drugs, or provide you a list, it always is handy if they complain down the road, and then Paul can say, well, wait, this person they forgot to give me this drug, so how would I have checked it? Anyway, get their mobile number if you can and ask if they text. If so, you can text them, and that's going to be becoming really important down the road. If your clients, you have all their mobile numbers and they've given you permission to text them, comes in really handy during AEP. And you might say to yourself, well, I'll call. That's great. Call's always best. But if you're just emailing existing clients, emails, as we all know, go to spam. They go to your social inbox. They go to your promotions inbox. Texts are answered with 90. Texts are opened and looked at 90% more than emails. So phone number, cell phone can come in handy. Get the email and get all this information and put it in a CRM of some type. I don't care what one you use. There's a million of them, but put it in a CRM of some type and gather that contact information so you have it when you need it. Really important to do that. Many people don't ask questions. You'd think everybody, okay, if you're an agent, you're asking questions. A lot of them don't ask these questions, and you really need that information. And then even more of them, they might ask the questions, but they don't document the information, so they don't keep it. So I don't know about you, but I can't remember. You start getting a lot of clients, and it gets really confusing. And then you don't want to have the scenario where they're calling you and you don't remember their situation and what's going on with them. So important to have a CRM and put that information in there. You can use Connector or Sunfire, but it really doesn't get enough detail. It's very good for some things like enrollment history. But examples of CRMs, Blitz, Medicare Pro, Radius, there's a ton of them. Less Annoying CRM. We're coming out with ours now, so we have one that we offer as well. But you need some kind of CRM. Connector and Sunfire, on the topic of systems. Again, if you're not using it, start using it. I still have a lot of people using Medicare.gov, and it's just super inefficient. Connector and Sunfire will save the drug list, the doc list, the pharmacy list. It'll save your enrollment history, your scope. You can record through there. Sunfire, you can record both on outbound and inbound calls. And on Connector right now, it's only on outbound calls, but that's going to change soon. But anyway, if you're using Medicare.gov, you should move away from it. Really not an efficient way to go about it. Recordings, which I mentioned, were very important. Again, use Connector or Sunfire. There are a million office solutions out there. Most of them are web-based, and it depends. They can be clunky at times. They really can. I've had a lot of people have trouble with some. I know some are very good, but you can use an office solution if you want, so you can record the entire conversation. However, my suggestion is use Connector or Sunfire and record the enrollment call. All right, so then we get to Medicare A and B, and this question comes up a lot. Should agents know Medicare A and B benefits in the enrollment rules? Yes. There's really no other answer to that. Remember, you're talking to people about why they should take an Advantage plan or go on a supplement. Really important that you know the holes and the gaps in Medicare A and B and what they are when you're having this conversation, because it'll come up. And then even more important, that you understand the nuances for people turning 65 in enrolling in Medicare A and B. We were talking about it earlier. Are they a delayed Part B? Do they meet all 3 waivers to waive Part B? How do they enroll? When do they enroll? Is A going to retro back? You need to know those things if you're going to do a really good job, especially on T65s. And examples of that, like if somebody's birthday is on the 1st of the month, well, their Medicare doesn't start the 1st of the month, it starts the 1st of the prior month. Some people forget that or don't know it. Part A will retro back 6 months. If they're a delayed B enrollment, delaying late in A and B, A is going to retro back up to 6 months. So good to know, especially if they're making an HSA contribution. Know your delayed Part B enrollment rules. Know your valid waivers for Part B past the age of 65. Again, there's 3 criteria to waive Part B. Using an SEP election during the IEP. So I've done this. Somebody is turning 65 and it's past the month they turn 65, their date of, their birthday month, and it's in the last 3 months, and I forgot, and they've also been losing group coverage, and I want to get the exact month I want, so I've tried to use the SEP for losing group coverage. Well, it doesn't work when they're in their IEP. You can't use it. You gotta use the IEP election. Just stupid things like that. Guaranteed issue period for Medicare supplements and enrolling in B. The delayed BICEP is prior to the B start date on an Advantage plan. That happens a lot. So Ed is 67, enrolls in Part B when he's 67. And I might think to myself, all right, well, he's got 3 months now to enroll after his effective date of B. He doesn't. If it's an Advantage enrollment, that enrollment application has to go in prior to the B effective date for using the new to B election. So just study this stuff on your own. Again, I'm going to reference webinars about this, but it's just the nuances and the little things you need to know so you don't lose enrollments, so people don't get pissed off, so you don't get complaints, all those things. Just be well-rounded, and it's not going to make you exciting at a party. So I'm not going to help there, but you need to know Medicare well. Although it is handy for if you're having a conversation with somebody you don't want to talk to, you can start talking about this stuff and they're gone. So that's a nice thing about it. Know the Part B and D IRMA rules and how it's calculated. Pinnacle does have a penalty calculator for B and D on their website, but you need to know the IRMA amounts, and you got to remember to tell people about it, because that's a surefire way to have somebody get really upset with you if you don't tell them that they might be subject to an IRMA on B and D. Part B and D penalties, again, knowing what the valid waivers are for B, knowing you go on Pinnacle's website and calculate those to see what they are. And I do see we have some questions coming in, and I promise I'll answer them at the end. Okay, so basically talking about what systems you use, talking about knowing A and B, talking about the information you have to get from the prospect, whether they're turning 65 or they're already 65. Then determine the right product, and to a degree it depends on the situation. So maybe you're talking to somebody who's 68, you're doing a phone sale or whatever it may be, and they're already on an Advantage plan. The key thing, and I've learned this from people that are really good at phone sales and really good at working with people already on Advantage plans, usually an Advantage plan, maybe they're on a supplement, but find out what they like and don't like about their existing plan. You find out what they like because maybe you can find a product that has more of what they like, especially going into 2025. We're going to see some big reductions on extra benefits on Advantage plans. Big opportunity. But also find out what they don't like about it. Both are important, because if you find out what they don't like, maybe you can find something to fix whatever that issue is. But just as important to find out what they like too. So ask both questions when you're talking to them, and that's how you determine the need, and that's how you can find another product, hopefully, that offers something a little better in line with what they want. Use Sunfire for the quickest comparison of extra benefits. I mentioned Sunfire, not Connecture. Connecture is going to make some upgrades, but as it stands right now, the comparison tool on Sunfire is better. Just simply is. It gives you not only the regular benefits and compares 3 plans side by side, but it also will compare all the extra benefits for you: dental, vision, things you forget, dental, vision, over the counter, transportation. It's on the initial comparison. It's easier to use, in my opinion. All right, let's say the person is turning 65 or new to Medicare. Then you get into the whole thing of explaining the difference between a Medicare supplement and a Medicare Advantage, and laying out in a way they can understand. It's one thing for us to understand it, but you got to lay it out in a way they can comprehend the good and bad of each, pros and cons of both. I have a webinar on this as well that I'll reference on the last page. There's really kind of a setup, but your whole idea is you want to give them a general understanding of the 2 products, strengths and weaknesses of both, and then they'll make the decision for you. You really they won't hem and haw too much usually. They'll kind of gravitate towards one because they'll apply it to their situation if they understand. So as you're going through this, you'll find out what's important to them. And again, going back to the general utilization question, that always helps. I mean, if I talk to somebody and they say, I'm turning 65 and I go to the doctor once a year, versus somebody who says, yeah, I'm really healthy, but I see 6 doctors a month. That happens, right? And I was hospitalized 3 times last year. Well, you're going to kind of then position this conversation because they may not know it yet, but they're probably going to be a med sup candidate. Knowing GI states versus non-GI states is a big driver for Advantage. If you're in a non-GI state where supplements can be underwritten down the road, that might push you a little more towards a higher percentage of sup enrollments versus a state like Connecticut or New York, where it's guaranteed issue all the time. Well, you'll see a much higher percentage of people start off in Advantage plans in those states because they can always move and they can't be underwritten. Okay, so once you have an understanding of what's important to the client, you've given them the basic understanding, that's where you would quote and compare the plans on Sunfire. You could email or text them that comparison if you want. If you're in front of them, you can just go over it. For med sups, you can quote sups on those systems. If you want to get specific though, and I have a lot of conversations about this and people that don't know certain things that are important to us to know, you might want to go on CSG to get details. And details like, okay, Humana in a certain state, they have a household discount. So it's 7%, but their discount is if there's somebody in the household age 18 or older. They don't even have to be on a Humana product. They don't have to be related even. If they live in the household, then that person's eligible for the discount versus another company that says we only give a 5% discount, and that's only if there's a spouse in the home that is also on our supplement. So knowing the difference there can be big from a rate standpoint, can be the whole difference actually. And that for you can be a gigantic difference because you got a whole bunch of people there on a certain plan, but then a new company comes in and they can do a household discount at 7, 8, or 9%. Well, that opens it up. You got a lot of people suddenly you can show the same supplement for less cost. With your med sups, it'll mostly be plans G and N. I mean, that's the high majority of supplements that are enrolled in. But knowing high deductible G doesn't hurt. High deductible G, I think if we really said and people knew the benefits of it, you'd have a lot more clients. And if it paid more commission, you'd have a lot more clients in high deductible G. So knowing how it works, knowing that it is not a straight up $2,000 deductible is important for us to know. That's where the value is in it. And if you are going to sell it, being prepared to include ancillary benefits, especially hospital indemnity and cancer with it, is important. For Advantage plans, when you determine the right product, obviously the market will drive that. So the state you're in, the county you're in is going to be all over the board, which plan looks the best. But really what plan is the best is the one that fits the person the best. You know, matches the doctors up, covers the drugs for the lowest cost when you run it through Connector or Sunfire, and maybe has the best network. Maybe there's a network issue at play. So the thing I've learned along the way is not to swim upstream too much with this. So I can go through, I can have a person who is obviously in my mind a med sup client, but really it doesn't matter what I think. What I get a lot of is agents sometimes will know in their head, this person should be in a sup. The person wants though, for whatever reason, their mind is set on they want to be an Advantage plan. That agent trying to do the right thing will talk them out of it and say, no, look, you really need to go to a sup. And that usually doesn't go well. Because if anything goes wrong, if the person gets sick and is on a plan end and has copays, or if they're just mad in general about the premium, they're going to blame you because they're going to say, I wanted this other plan. So what I usually say is, it's your job to make them aware of the differences. You can tell them what your opinion is, but if they really want to enroll in something, enroll them in it. Customer's always right. If you want, you can document the fact that you suggested otherwise. That might come in handy down the road. That you suggested otherwise, but I wouldn't fight with it too much. I would let them go on the plan they want in that case. I just, again, I see a lot of where the agent's like, nope, do this. And I disagree with that strategy. I think ultimately it causes problems. Speaking of documenting, so a big one is if you're moving somebody from one supplement to another supplement or from supplement to Advantage, you got to remember to tell them to cancel their current supplement. And more importantly, document that you told them. We get a lot of people, they move from one supplement to another, and the agent, I think in most cases, did tell them, hey, cancel your existing supplement. They forget. It's 8 months down the road. They never canceled it. They have 2 of them now, and then they're going to blame you and say you never told me. So if you have that documented, meaning maybe you send them an email as a reminder, hey, by the way, great talking to you. I know we're going to move to this new supplement. Reminder, cancel your old one, or we're putting you in an Advantage plan that won't automatically cancel your supplement. You got to remember to cancel it and put that in writing. That to me can come in handy down the road for you. Okay, build in a cross-sell in your sales. I won't hit this much because I've kind of hit this to death in webinars recently, but build other products into your sales, especially for Advantage plans, and especially going into 2025. You are going to see higher out-of-pocket maxes. The carriers are getting squeezed hard financially, so you're going to see higher out-of-pocket. Well, I hope they're not just getting squeezed in general. I think that'd be impossible, but I meant financially. So anyway, they're going to have higher out-of-pocket maxes on the plans. You're going to see less ancillary benefits. They're going to be reduced the extra benefits. See higher copays. This is even more important with all that's going on. The $2,000 drug cap's going to hurt benefits. A lot going against the plans this coming year. So build in a hospital indemnity and cancer plan with your zero premium sales. Again, I got a webinar very specific about this. The way you do that is you talk to them, you show them the holes in Advantage plan, especially with hospitalization and how that can drive their out-of-pocket up, and really with cancer. I mean, cancer is going to fall under either major radiology, 20%, or it's going to fall under Part B as in boy drugs on chemo, 20%. Going to max their out-of-pocket out. That's going to be higher coming up. So build those products into your sale. Same thing if you're selling a high deductible G plan. I also recommend that you have a good standalone dental and vision product ready for your med sub sales. And the note I made in there is, unfortunately, I guess depending on how you look at it, we might get into a situation where we see people selling standalone dental and vision products with Advantage plans, given what I think is on the horizon for 2025. Again, have a webinar on this topic. This one, youtube.com, the YouTube address, I've shown it to you 5 times. But it's why agents should include ancillary products with MA sales. It's on the YouTube channel, and I'd recommend you watch it. If some of this, if you're looking for more detail on this topic. Okay, know all the election periods. This one comes up a lot still. AEP, but especially OEP. I get a lot of questions saying, hey, what can I do or can't do during OEP? Got to learn those things and know them. So AEP, OEP, SEP, and new to Medicare elections for Medicare B. Advantage, Part D, Med Sup. Study and learn these rules, be able to reference them, try to imprint them into your brain, because believe it or not, even people who have been selling for a long time still will make mistakes on what you can and can't do during OEP, for example, or they will confuse elections for Part B versus an election for a Medicare Advantage, and they're two different things. They run concurrent with each other in most cases, but there are differences, and I get a lot of people who get confused between the two. For example, being new to Medicare Part B is not an election for a Medicare Part D plan. So get that a lot. If got a client, they are late B enrollment, so maybe they're 68 years old, they enroll in Medicare Part B, and we tend to think to ourselves, well, that's an election, so if they want a standalone Part D plan, no problem, but it isn't. You don't need Part B to get a Part D plan. When you got Part A, that was your election to get a Part D. So just remember that. That's an example. Or having other coverage is a waiver for the Part D penalty, but not necessarily for Part B. So if I'm retired and I go on COBRA, or if I'm lose my job and I go on COBRA, but I'm Medicare eligible, that'll waive my D penalty. But it's not, just having COBRA isn't a waiver for B. They're two different things. And it's just a good idea to have them clear in your mind. I forget sometimes little details and have to go look them up. And quite honestly, I'll probably look at my cheat sheet as I'm talking to somebody on the phone, and then I'll pretend like I just remembered it and knew it. But anyway, know all the SEP elections. And if you don't use FEMA.gov to see your disaster elections, start using it. FEMA.gov. You can see all the past disaster elections. You can see the current ones, and you can see how long they're going to be effective and active for. One unfortunate thing about that is because there's a disaster declared, an emergency or disaster declared in a state, and it's active, It doesn't necessarily mean all the carriers have adopted it. Some probably have, but it doesn't mean they all have. Enrollment methods is pretty straightforward. Again, use Sunfire for email, text, or voice signature. Sunfire does voice signature. Connecture is email or text. They don't do voice signature right now, but they will very soon. You could use the carrier portals. I know some people do that. I don't think it's as efficient. If I'm enrolling people in 5 or 6 different plans and I got to learn 5 or 6 carriers portals, that doesn't make sense to me, where I can just get to know Sunfire or Connecture, get good at it, and then I can enroll everybody through there. However, if you want to do that, just make sure you know them well. There's still a lot of people doing paper, even after COVID and all that stuff. Still got a lot of paper people out there. But, you know, and you can do that if you want. But out of all this, the most important thing is to practice some fake ones, whether you're doing Sunfire, the carriers portals, a paper app. Do some dummy ones first. We get a lot of scenarios where people are in front of the client and they've never used that carrier's portal, or they're trying to use Sunfire for the first time, and that's not the time to be trying to use it for the first time. And then the last one I'll mention is on a paper app. If you've got a new carrier you're going to write and you're going to use paper, review that app first, because nothing looks worse. And unfortunately, I've kind of been an example of this in the past, if I admit it. Nothing looks worse though than you whip out an app to write somebody with, and it becomes pretty obvious you've never seen it yourself. So review them first before you write somebody, so you feel pretty confident that you'll be able to pretty smoothly get through it without getting hung up. And again, I see more questions. I'm going to answer them in a little bit. Okay, tracking, follow-up, and referrals. This one to me is applicable, resonates well because this happened to me. This is a sneaky way you can lose the most earning potential over time. Medicare, as we all talk about, is a recurring revenue business. It is. That is the strength of writing Medicare. It's a pension plan. It's recurring revenue, and you don't have to recreate the wheel and keep writing to get paid. So if you want to build up a big book and then go take 3 months off, you can. That's the point of it. Having said that, some things to remember that will cost you enrollments and cost you clients if you don't. And again, these are some things I didn't do as well as I wish I would have. I built a pretty big book, but it would have been bigger had I done some of these things. Again, when you write somebody, get their email and their cell and ask them if you can text them. Because down the road, like during AEP, if you can send out a mass text, and there's mass text apps, if you can send out a mass text of plan changes and stuff, those texts are going to be reviewed a lot more often and at a much higher rate than an email will. Follow up with all your clients during AEP. Phone call is best. Nothing replaces the power of a phone call, multiple calls in fact, but something's better than nothing. We get a lot of people who just don't call their existing clients, and if you think about it, it just makes no sense. It costs you way more to acquire a new client than keep one. And their revenue is just as good as anybody else's. So follow up with them, reach out to them, keep them on the books. If you don't, your attrition is going to be much higher. You know, multiple contact methods, whether it be text, email, and phone. Text and email is better than nothing, but phone, all three really is the best, but phone should not be replaced. If you have the capacity to call them or have somebody make those calls for you during AEP, you should do so. If you can't close somebody, rebook them. I used to go see people when I was younger, and I'm pretty old now, so this is a long time ago, but I still remember. I'd see people when I was younger, they had a really good plan or something and I couldn't move it. And I just should have booked them right then for the coming AEP, even if it was 9 months from now. You book them, and that way you fill your AEP up over the course of the year when you're meeting people that you can't close. Then you got a lot of appointments during AEP. If you got somebody who's turning 65 in 3 years, put them in your calendar. 3 years is going to come quick. Put them in your calendar, call them at least 6 months before they turn 65. They're not going to call you. You need to call them, and you're going to get that enrollment, but hit them at least 6 months before, maybe even a little earlier. Spouses is a big one. I always assumed that a spouse would call me. I'd write one spouse and assume the other, who's maybe going to be 65 in 2 years, would call me when they're turning 65. They only do so about 20% of the time. You should call them. It should be in your calendar, even if it's 2, 3, 4, 5 years from now. Someday it'll pop up and you'll know, okay, they're going to be 65 in 6, 7 months. I got to call them. And again, like I said, Medicare is a recurring revenue business. It's important to do those things. And then lastly, I will say referrals. Come up with most agents don't ask for them. And in the Medicare business, that's a shame, really always should be. So come up with a way to ask, come up with a way you're comfortable to ask for referrals. It doesn't have to be cheesy. It can be something along the lines of, yeah, it's great helping you out. And again, if you got somebody who's turned 65, or, you know, I can work with multiple plans, multiple states, if that's the case. You got somebody on a plan, usually I can better their position a little bit. I'd love to talk to them. You know, it's something you're comfortable with and get consistent in asking it. More agents don't ask for referrals than do. And it's really easy in the Medicare business to ask for them. It's not like selling a life policy. Provide a referral gift. I strongly recommend that if you're not doing that, you do it. It will help. It will increase your referrals. I did it myself. Initially, I started at something of a $15 value. Being cheap, I experimented with going down to 10. It didn't make a difference. It increased my referrals. 10 was just as good as 15. It's just the thought that counts. Can't give them cash, and it's got to be less. You know, it's got to be 15 bucks or less. Dunkin' Donuts cards, Starbucks cards, gas cards, so whatever you want it to be. But if you get a good referral, send that gift to the referrer every single time, whether you close the case or not, as long as it was a legit referral. It shouldn't be just if you close. If they refer you somebody, send it to them. We have a lot of agents, I work with a lot of them, who they don't even have to solicit business any longer. They simply get enough, we have some on this call, they get enough referrals that come in that they get a steady supply of people they can write just from referrals. Well, this is old school and nobody likes to do it anymore, but that's why it's so good for the people that do. Create relationships with centers of influence, other insurance businesses, P&C agencies. It's endless, the amount of people, but create a relationship. You can pay them. You can pay them $100 per enrollment legally. If you can create a couple relationships there, it can be very beneficial to you. Just make sure you pay them the money. And again, very few agents do these things anymore. And that's what can set you apart. We've got, you know, so many people are on the phone now, and phone is so transactional. That book, and I'm nothing against phone business. We have some people that do it super well. But if you're going to do face-to-face, do these things. I would argue too, if you're going to do phone sales, I'd follow the same set of rules here. Even with phone sales, you got to go call that book during AAP, and you should do a referral gift anyway. It'll help with your retention. Phone sales is a little tougher on retention. This will help a bit with it. Okay, so I went through a lot of stuff. I high-leveled a lot of it. If you want to get specific on all these things, where do you do that? So it's YouTube channel. We've made all these videos. They're all made. YouTube.com/Crowe Medicare. And I gave you examples of ones. So using Connector and Sunfire, and what I put in quotes is the name of the webinar. So you can just go on the channel, look at the webinar, and then bore yourself to death listening to me talk again. Or if you want, just Google it. You know, if you really just can't stand listening to me anymore, I can't stand hearing my own voice a lot. So if that happens, I'm no grudges being held here. But anyway, here are the webinars. So using Connector and Sunfire, I did a demo. It's on there. Scope rules, it's a big one. So one that focuses on that. Medicare Part B rules. I talked about late B enrollment. Got Advantage versus Supplement on there. Medicare B and D IRMA. 5 keys for a Medicare compliant phone recording. That's a little dated now because Connector and Sunfire script all of that for you. And I'll just touch on that for a minute. I get so many people that worry about what they say in the recording. That is not near as important as doing the recording. Not doing the recording at all will get you in way more trouble than doing the recording and saying things wrong in the recording. But when you're using Connector and Sunfire, it's kind of hard because they script it all for you anyway. But I'll say it for the 10th time, record the enrollment call. If you do nothing else, when you enroll somebody by phone, record the enrollment call, make sure you do it. I have a webinar on high deductible G, how to retain clients. That's really more on people with a big book, how to efficiently manage that book, keep it on the books, and how to grow it just based on that book. And there's a lot of different ideas in that webinar about how to do that. And then definitely, if you're not going to watch any of these, you're like, yeah, I'm not going to watch those. Watch this last one. 2024 Medicare commissions and how they pay. That's a big one. There are a lot of people selling And it's not simple. You know, it's not as easy as, oops, we're in Connecticut, for example, or in New Jersey, and I just get the full commission. I wish it was that easy. It's not. There's rules. And we go over those in this webinar and talk about different areas, like when are you going to get the full commission versus when are you going to get the full commission, but it's prorated, versus when are you just getting half? How are the renewals going to pay? When are they going to pay? Remember, during AP, you don't get paid on anything you submit during AP until at the earliest January. So examples of some webinars, there's certainly many more in there, but those are the ones that I thought were kind of most on topic with what I just went over. Oops. Okay, that's it. I made one note to remind myself, those who aren't familiar, Assurance IQ is a huge call center. They're very big, over 1,000 agents, call agents. They're shutting down. They announced it yesterday. Long story short, Prudential bought them in, I think it's 2019, for $2.3 billion. Yeah, billion with a B. I think that year that they bought them, Assurance had done $1 billion in Medicare sales. I'm not sure what happened along the way. It started going downhill right away. And maybe the fact that it was trending in the wrong direction, Prudential had paid a lot of money for it. And maybe also the fact that marketing money is in great question now. Guess it caused them to close the doors. So you're going to have a lot of agents suddenly that are free agents that are out there. Last thing I'll say is on the final rule, I'll mention that briefly. There's no question anymore about that. Medicare clarified, carriers are allowed to pay overrides. That's it. They took the mystery out of it. So they clarified that carriers are allowed to pay overrides. It is now just up to the carrier. It's a business decision. Are they going to pay them or not? And if so, how much? So it has nothing to do with CMS anymore. This is all the carrier. I know they're under tough conditions because of what's happened with the drug caps and the heavier weighting on star rating and all those things, but it's not a CMS thing anymore. It's just up to them at this point. Okay, let's see if we have any questions. We have a couple. Somebody said I'm late. I disagree, Paul. I was not late. I was 5 minutes early. Okay, does Aetna still have money for T6570? Yes, yes. Can you take doctors and drug information when you email a scope of appointment and wait 48 hours before going over Advantage plans or PDPs? Yes, certainly. So you could talk to the person, you could get the scope right then, gather their information, load it into the system, and if they called you, you don't really even need a 48-hour scope because that's an inbound call, but let's assume you called them. You could do exactly what you're saying there. Get the scope, load their information up in Connecture or Sunfire, and then have a meeting and run stuff. If born 3/15/76, how old will the person be? I think they're 48. I think they're 48. Let's see. Recordings on Connecture, can they be downloaded or how do we get them? Yes, Connecture saves all of them. The way you get them is request them from either Connecture or Pinnacle. Probably easier to request them from Pinnacle. You just say whose recording you need. Now I'm going to confuse Connecture and Sunfire. One of them, you can actually pull it right off your portal yourself. And again, I'm going to confuse the two because I just talk about them every day. One of them, you can just grab it yourself. It's a little, you got to kind of look at it and figure out how to do it, but they're on there. The other one, you have to get it from them or Pinnacle, but you just request it from them. Okay, what else do we have? How does the last 4-day scope rule apply in ISEP when we're 1-2 days away from Part B start date, but the ISEP runs a couple more months? If they don't enroll now, they won't have RX coverage when Medicare starts. Okay, the last 4-day rule is it waives the need for a 48-hour scope if they're in the last 4 days of an enrollment period. So in that scenario, that wouldn't be a waiver for the 48-hour scope. You'd need a 48-hour scope unless that person called you. If it was an inbound call, then it waives the 48-hour scope. Or if that person was a walk-in appointment, it would waive the 48-hour scope need. Do you only need to say the medical statement on record? Do you only need to say the medical statement on record or whole enrollment? I'm assuming you mean for phone enrollment. Yes, you're supposed to read the whole statement, but again, I'll go back to my previous kind of stance, is recording is more than half the battle. So if you record, that's the first step. If you read the statement abbreviated, you might get dinged to a small extent, but you are supposed to read the whole thing, yes. You have to read, I'm not sure exactly what you're referring to here. You got to read what's scripted on Sunfire. So I'd suggest running a sample on Sunfire, a fake case, so you can see what the scripting looks like. Can you review the 3 Part B waiver requirements again? Sure. Okay, there's three criteria you need to meet to waive Part B over the age of 65. Here they are. So number 1, you got to be actively working or getting coverage through an actively working spouse. That one's important. So remember that one. So that's 1. Number 2 is you have to, so 1, you got to be getting coverage. You got actively working is 1. Okay. Number 2, you got to have coverage through the employer, through your spouse's employer. And then number 3 is the group must be a group of 20 or more. So that's the 3: actively working, coverage through the employer, either via your own coverage or through your spouse, and the group's got to be 20 or more. Those are your 3 waivers. If at any time they don't meet any of the 3, then they're no longer validly waived. Meaning, let's say a person goes on COBRA, or their company says, hey, Steve, you're a heck of a guy. We're going to leave you on our coverage for another year, even though you're retired. Well, Steve isn't actively working, so he does not meet the waiver. He's got Enrollment B. Even though he has coverage, he's got Enrollment B. He's not working. Good question. Any other questions? Okay, I'm always told that I hang up abruptly. I'm not doing that, so I'm just going to say, if you got any other questions, send them in. I'll be here for a second and I'll answer them for you. I should have thought of some notes or something, some speaking points or some facts, maybe some worthless facts. All right, looks like we don't have, oh, here we got one more. Can you take doctors and drug information when you email SOA and wait 48 hours before? Yes. So question is, when you talk to the person and you get their doctor, drug, pharmacy information, can you get the SOA? Yes, you can. Somebody said, thank you, this was helpful. Well, thank you, I appreciate that. I sold for a lot of years. I still sell once in a while. I built a big book up. Medicare has gotten harder since then, but I still write here and there just to stay relevant and know what I'm talking about. But it's definitely hard to navigate all the rules. But you know, they're fairly common sense, and if you do the basic things I talked about, you'll be fine. All right, it looks like that's all we have. So I guess I will. Oh, we have one more. Do you have a video that covers how to answer, how to fill in the following 2 fields on the scope form? Initial method of contact and 20 plans presented. Looking for the actual wordage. I'm not sure I'm following the question. Do you have a video that covers how to answer, how to fill in the following 2 fields in the SOA? Well, initial method of contact is just how you got in touch with them. That could be a call-in, mailer, referral. That's number 1. Number 2, plans presented, looking for the actual wordage. Plans presented would just be, you're getting maybe thinking too much on this one. It would just be Medicare Advantage, Med Sup, Part D. So what did you talk about? Those would be the ones that you would put on there. You don't have to get company specific on that part. It's just the type. Okay, no problem. No problem. All right, everybody. I hope you all have a wonderful day. Remember what I said about the final rule. That's very positive for us. And again, it's in the carrier's hands now, up to them. And hope everybody has a great day and a good weekend. Thank you.